Welcome to Slice of Piefer. I'm Dr. Piefer with Taylor.
Hi there.
And today we are blessed to have with us Linda Nelson, probably one of my best friends. I'm sure she'll tell you that.
Well, I heard you tell everybody that.
Yes,
so.
This is true. This is true.
So I'll feel very special.
She is one of the busiest women in the Woodlands, and I love her to death. We get to plan the physician wine dinner together. We get to do all kinds of fun stuff. She serves on the Woodlands Township, position number 2. So we're going to keep her running unopposed, right? That's the plan.
Well, I was unopposed this past time, and I can tell you it's easier to campaign when you have no one running against you. So I will run again next year. I'm not running this year. It's a 2-year term.
Awesome. Awesome. Well, thank you for that. She is the chairman of Visit The Woodlands.
Yes.
Awesome.
I actually love that position. It actually comes from being on the township. They elect a couple of people from the board, and then I was elected to be the chairman of the board. It kind of goes hand in hand with what I do at work. I do a lot of marketing, and that deals with bringing tourism into the Woodlands area. And it's amazing the things they do behind the scenes that I never knew that they had done. They have site selectors. They go all over the country to talk about what we offer here. And their analytics show that it's actually working really well.
That's awesome. Very cool. Director of Business Development at Memorial Hermann the Woodlands Medical Center.
Medical Center, right? So we actually rebranded around 7 years ago to Medical Center once we got trauma to a higher level NICU, 5 different ICUs. So we met that Medical Center branding that we feel like we earned it for sure. But yeah, I've been there. It's almost 30 years. A little bit about me. I actually stayed home for 14 years with my kids. And then my husband had said, hey, you know what? We're getting close to college. I think it's probably time for you to go back to work. So came back as a part-time volunteer coordinator. And I think that lasted a day. And then I got into another role and just continued and absolutely love working at Memorial Hermann the Woodlands. I think the leadership is wonderful. The culture is incredible there. It's 2 minutes from my home. So to work and live in the Woodlands, it just doesn't get any better than that. I can honestly say that. Physician wine dinner. So one of my jobs, and that's what he's leading me to talk about, he's mentioned it twice now, is, yes, one of my jobs I actually love. I have several roles under the business development, and one is definitely the marketing side of it. But my favorite is actually the community relations and the physician relations. So when I deal with people like Dr. Jason Piefer, just thoroughly enjoy. We have several events each year. We just finished our wine dinner, our annual wine dinner. A few months ago, we had our female physician wine dinner that Dr. Piefer was a part of. He was the medical, what were you called? Chief of Staff. Chief of Staff for 2 years. And then 2 years before that, he was leading up to that. So he was a part of those for a long time. He couldn't make it this past time as far as the planning of it. But it's really fun. We get together with the leadership of the physicians. They help choose the wine and the meals, and it just seems like it's a lot of fun. And then we had almost 100 physicians at the Palmer course. Back about 4 months earlier, we had the female physician wine dinner, and that was at the Audrey. We bought out the Audrey for that. And then we have Top Golf coming up, where we'll be sharing Memorial Hermann Northeast physicians and Memorial Hermann the Woodlands physicians, and he's pointing to himself because he's such a good golfer. And then we'll also have we'll also have an APP event in December, a holiday reception for our nurse practitioners, our all the ones that don't consider that they're not actual physicians, because they're very important as well. We don't ever want to overlook what you do.
I don't feel overlooked at Memorial Hermann the Woodlands, so we're all good.
Glad to hear that.
No, I mean, as far as I've worked at many places, and I've always loved getting to go to Memorial Hermann, especially Memorial Hermann the Woodlands. There's no other place that I felt as much collaboration, I would say, with not just physicians, but the administration there too.
Yeah,
it's awesome.
I have to agree with you. It's when you walk in, you just feel like it's a special place. And 30 years later, I still feel that same way. Good. You know, we've got great leadership. We've got Justin Kendrick as the CEO. Before that, we had Josh Urban, who was great. And then before that, we had Steve Sanders. So in 30 years, I've had 3 wonderful bosses. I can't imagine anybody better than those 3.
Yeah, awesome. Each one of them awesome and great to work with as a physician. Justin's already committed to coming on the show like at least 10 or 15 times. So Justin, I'm talking to you. He definitely watches. There's 100% chance he's going to see it for sure. For sure.
I'll make sure he does.
Get a DM with his pie preference pretty soon.
Yes,
I'm betting during the show we may get that update.
We got to go gluten-free though.
Yeah, exactly.
Go gluten-free pie.
That was the first thing I just started thinking. What does that look like?
We can do it.
Easy
we
peasy.
can do it.
Yeah. So just today, I just left we're trying to figure out what to serve at our In the Pink of Health luncheon. It's our 25th anniversary. It's on October 24th. So we just had a tasting for what our meal is going to be at that. And we always keep in the back of the mind that Justin's gluten-free. So we mentioned to him about 5 times during this tasting, well, what can he eat if this is what we're serving? Mm-hmm. So we always keep him in the forefront of what we're thinking.
Being gluten-free, Taylor has some kind of funny stories about me and my gluten-free diet that I go on for kind of just hours at a time.
So the other day we were in the physician's lounge and they have these awesome like gluten-free brownies, but they're like this big and they're like
the best.
But they're also like 400 to 500 calories. I mean, they're not.
There's no calories in the physician's lounge. We don't count that.
My scrubs would disagree with you, but he was eating one of those and another doctor walked up and said, "Oh, you're gluten-free," and he said, "Yes, I am." And I had just like watched him eat Cheez-Its or something like that, or not gluten free.
For those 10 minutes, he was
for that time with that brownie. That's my level of focus. That's my level of focus.
Exactly.
Okay?
I'm gluten free in the moment.
They also have the best chocolate chip oatmeal cookies in there to die for.
Yeah, and I normally wouldn't like. I'm a plain chocolate chip cookie person. I don't want anything else in there. But the ones they serve there, they not only have like some kind of nuts and oatmeals, but they also have coconut in them.
Yes.
And I would think that would be terrible because I'm not a coconut person.
I'm with you there.
But they're so good.
I know, they're so
I can't. I just have to allot that 160 to 200 calories is coming out of the bank
I
that
hate to
day.
say you, but that's probably more like 400 calories too for each one.
I have looked it up. If you go off the Otis Spunkmeyer website, their Rocky Road cookie, which is what I think it is, it's around 200 calories.
Okay, that's really funny.
There's some good approaches to that. So if you're eating those desserts standing up or in your car, then none of the calories count. And that I am a medical doctor, so you can take that with you, Linda, in case you're wondering. So like the French fries in the car, when I show up at home and it's empty, I'm like, I don't know what happened to it.
So if I have my Chardonnay and my French fries, my 2 favorite things on earth, that's standing up.
Yeah, as long as if you're standing at the bar, you're good to go.
Please talk with your own medical doctor before taking any advice that he's giving on this podcast. None of it is to be taken as real medical advice.
Taylor, man, shot down again. Well, some of my favorite Woodlands memories. I mean, I've gotten to volunteer at the 4th of July parade. I got to see you. I always send you a text because you're on one of the lead Memorial Herman floats, or the lead township float. Actually, I think this year, weren't you?
Yeah. So they put the township people in the front, which makes it really good for me because halfway out, I jump out of that car because I'd much rather be riding in the Memorial Herman float and run to the Memorial Herman float, awesome. Which we won again this year in one of the different areas. So, and it's a big part of what we do at Memorial Herman is that 4th of July parade for sure.
And Life Flight flew over Market Street, right? Or they were supposed to fly over or something?
So I have actually a really funny story about Life Flight. Now it's funny because it's several years past. But we were, I hold the microphone to talk to the Life Flight helicopters. And I tell them when we're almost close by because I want them to hover over us just as we're passing the judges' stand. So I'm saying, okay, we're almost there, okay. And then they're hovering right over us. It's the coolest thing on earth. Here we've got a PD ambulance from Memorial Herman. We've got one of the best floats there. We've got 50 people walking behind. You know, it's just wonderful. And then it was Josh Urban at the time, and Josh is there. Linda, they're really low. Linda, tell them to go up higher. Well, they knocked down all the tents. I also had a brand new pair of Rayburn glasses on my head. Never saw them again either.
Just blew away.
So we were warned that cannot happen again, and that's why they don't exactly hover over us like they did before. We got in a little bit of trouble over that. But.
Nice. My son, we volunteer usually in the setup where all the big lines are. And so we'll help people get set up. And then this year they were like, we need people to go and be spotters and go walk through. So Cameron and I got to walk the whole parade. We were in there like walking with the
What
volunteers.
were you spotting?
You're trying to, well, they told us we had two things. We needed to make sure that people kept moving because,
Yes.
people are passing stuff out and all that
Yes.
stuff. And then kind of the other more nebulous instruction was make sure that if there are people who try to join the parade, that you point them out to security because you're not allowed to come out of the crowd into the parade. So we didn't see anybody jump into the parade, but we had a kind of a fun time. We were with, oh goodness, what was it? Legally Blonde. They did one of the schools was
they
doing
were
Legally
great,
Blonde. So yeah,
actually.
so they were just going crazy. My son is a junior, and they were like, "Hey, you should come be in Legally Blonde, the production."
So who were you with that you were doing that? Were you with a group that you were volunteering? What was
National Charity Roundtable,
it?
which
I
is
love Roundtable. I just
Yep.
recently spoke to a group of roundtables. I have something called Linda's Lessons Learned in Life. And I spoke to a bunch of them in the roundtable, and it was at somebody's house, and it was really cute. And the lessons are as practical can be. But one of them is walk that person to the car. Just don't say goodbye and shut the door. Go to the driveway and wait till they leave. It's the last thing they'll remember about you. So when I was leaving, they were on the kitchen, and I left, and I turned around. Here comes all 25 of them walking me to the car. I was like, oh my gosh, they actually listened.
That's awesome.
It was a good group.
I guess for the girls in the community, it's NCL, right?
Right.
And
Yes.
but that's girls and moms. But National Charity Roundtable is the boys, and it can be either the mom or the dad. So we get to help participate some. But
I didn't know anything about it until I was asked to speak at that. I was so impressed. I told my kids that, well, I have boys, this is what they need to do when they get older. I don't know when they start the roundtable, what age that is.
I think it's around. I believe 8th grade,
Okay.
7th or 8th grade, maybe.
Okay.
So it might be 7th grade actually.
Okay. It's a great organization. I was really impressed. And I was impressed with how many parents were there as well. It was in somebody's home, and it was a really nice event.
They have those certain number of meetings that they have to do, and the volunteer hours they have to have, and then they have community events. Interestingly enough, which I don't know that this would appeal. It might appeal to Taylor, but if they do enough community service, they get a dagger or an Excalibur. The person who does the very most has like a 4-foot tall Excalibur that they get. It's like a real sword they can put on their wall for doing 200 hours of community service. It's pretty cool. So that's always an interesting day when they hand out the awards, and then you have all the,
That is
you
so
have
funny.
hundreds of boys in.
Daggers.
This year it was in College Park, and they have their
And they're
little,
all fighting each other, I'm
they,
sure.
They actually do a lot better than you would think. But yeah, when I was that age, I would have been doing that for sure.
I like how
sure.
his thought is this might be of interest to Taylor because they hand out weapons.
Yeah, you like
you a weapons
like
person?
Renfest and other crazy weird stuff.
Do you like that?
First of all, Renfest is not crazy weird.
Garrett, one of my employees works at Renfest, and he also is an actor at Renfest. So
Okay.
he's going to come on
I don't even
here.
know what Renfest is.
Texas Renaissance
Oh,
Festival.
the Renaissance. That's okay. Yeah, they're different there.
Yeah,
So I am not a huge Renfest person. I do enjoy going, but I don't even go every year. I have small children. Like that's just some, at certain ages it's good to take them, and certain ages it's not so good to take them. So we haven't been probably in 3 years, but yes, I mean, I used to do theater. I used to really enjoy going to stuff like that. I didn't ever walk around with a sword on my hip, but now I'm thinking I might need to.
Yeah.
I don't know if they would let you into Renfest with one of these swords. They're like pretty much the real deal. Not that sharp, but
I went in with Thor's hammer one year.
Yeah.
See, the fact that you know all these things, that alone.
very, very true.
Dr. Piefer just thinks it's about making candles.
That's true. That's all I remember from being a kid going to Renfest was wax dipping candles, and I was like, that's it. I can't remember anything else. Maybe a little bit of turkey legs, but I don't know if that might have just been Schlitterbahn that I was thinking about.
We learned a new way of taking our kids to events when we're at the Renaissance Festival. 3 kids. We had 3 kids in 4 years. And I felt like the whole time all we said was no, but yet we spent hundreds of dollars there. But all they remember was, no, you can't do this again with the wax on your hands. And no, you can't. So we decided from then on that if we're going to an event, we're going to give them money. And then if you want to spend the money there, because it was absolutely insane how much money we spent. And we felt like we said no the whole time too. So that just changed our way of thinking.
I
Ever
do
since
a
then.
similar thing. So my kids are about that. There was 3 under 4. And so we do the same thing. I tell them, you have this amount of money, you can spend it how you want to at
Or
this
take it home and keep it.
Right. But when you're done, you know, or you can put it in your piggy bank and save it for something else that you want.
So my son would spend it within 2 minutes, and my daughters would take it home with them.
Nice.
So far, they all spend it and then beg me for more.
Right,
money.
exactly.
So
How old are your kids now?
Oh, gosh. Well, first of all, I want to thank you. He fit my daughter in yesterday, which was wonderful. And she's 38, 40, and 42.
Awesome. Mine are 16, 15, and 12, and Taylor's
7, 6, and 4.
so
Busy
but
times.
similar age groups as we move through. So
Yeah.
I try to give Taylor as much advice as possible about her kids. They call me Dr. Monkey. I oftentimes call her in the car when she's driving.
So they can hear.
And yeah, well, not so they can hear. Usually it's mostly about work stuff, but then they're usually chirping in the background.
Yeah.
Well, when we had our kids, we just decided we wanted them really close because there was 2 things. We didn't want to have to take friends on vacation with us, and we wanted to be able to see the same movies together. We
Nice.
never took a friend on vacation with us because they were so close in age, and we can always see the same movies together. So it worked for us. It was hard in the beginning, but I was a stay-at-home mom, so I didn't have to balance the work and like so many people do now.
Yeah. it was a little bit of, just chaos for me. I'm one of 4 kids, but we were all spaced out. My mom was a real big proponent of you should have your kids 2 years plus apart from each other. So that way the baby's not a baby anymore when the next baby comes. I'm Catholic. We had them close together. That's just how it happened. And I remember when I found out I was having another kid when my kid was 6 months old.
Oh, that is close.
Yeah, and she was about to have ear surgery, and my mother was up to visit, and she saw the pregnancy test in the bathroom counter and was like, "Taylor, you're having another baby?" And I said, "Yes." And she's like, "But you have a baby." I was like,
You'll always remember that comment, but you have one.
"Yeah, you have one."
Why
I
do you
said,
need another one?
"I know." I said, "Mom, you had 4 kids." She goes, "And mine were all spaced out, at least 2 years apart." And I was like,
Strategy. The strategy.
But they're like the tightest little group of people.
Right.
I mean, I sat there and listened to them play yesterday evening for a solid hour, just chirping back and forth with each other and engaging and no TVs on, no, just playing. And yes, it's chaos, but I wouldn't change it.
Totally agree.
We tell her, cherish those moments, right?
Oh
Because
my gosh. Yes, they
back
go
and-
like that. Oh my goodness.
It's
yes.
wild. And I mean, it's not every day you get to wear a sash to work like Taylor too. So, I mean, you got to tell your girls about this.
About having to wear a sash against my own
Taylor
want.
turned 22 on Monday of this week. So she's a big birthday.
Happy
She went
birthday.
happy birthday.
Thanks.
And she went to the NFL football game.
Oh, that was a good game.
Dallas and Green Bay, right?
Oh.
And the tie game. So
40-40, right?
yeah, like
That
kissing
was
your
so
sister.
depressing. You
It
watched
was.
it all night long, and then I just can't believe there wasn't another overtime.
I know. I knew that was the rule because my husband and I were talking about it during the game. I was like, man, I hope this is because the stadium was packed with both fans. I mean, it was full of Cowboys fans,
was a
but
great
I
game.
was the only Cowboys fan amongst a bunch of Packers fans. And so, it was good rivalry and good banter, but we all just kind of looked at each other at
Right.
the end like,
What
I
does
don't know,
it
be
What
mad
does it mean
or
at
sad
the end
or-
of the season? What do those playoffs mean? I
Right.
know.
Yeah, it was a little bit underwhelming, but the seats were great. I mean, he couldn't have done better for getting such great seats. I've never gotten to see a professional football game at that level before, so it was awesome.
Yes.
Reminded me of back
What
when I
a
was a
game, though.
cheerleader on the sidelines.
What a game you saw. That was a pretty impressive game.
Yeah.
Oh,
that was
yeah,
awesome.
very
Was
good.
it in Dallas?
Mhm.
So, you can take that bus that
Mm-hmm.
goes what's it called? Starts with a V, I think. But you can catch it right at the Marriott. It's $125. It takes you right to Dallas. There's a flight attendant in there giving you drinks. It only fits 22 people, I think.
Oh, wow.
It's amazing. Wi-Fi. There's
Mm-hmm.
a place that you can do your work on the way up there. Boulogne, Valon.
We should have done that when we went to the Aspire tour.
No,
Yeah,
but
we-
think about it. They do like 4 trips a day.
Oh, cool.
Yeah. They might not have stopped at Whataburger like we did though. or left at 4 a.m.
Or had plenty of beef jerky.
We did have a lot of beef jerky. We had a lot of snacks. I was responsible for the snacks, so We had a lot of beef jerky, some cookies, some chocolate. Yeah,
That's because you're
it was very
gluten-free.
healthy. It
That
was
all worked.
He
Yeah.
volunteered himself to be in charge of snacks. I repeatedly told him, I will bring my own snacks. I have my own food. Like, I have my own water. I have my specific things that I like to eat or whatever. And there was only like 4 of us on this bus. And he's like, let me get an entire ice chest filled with Coke Zero and
So
water.
who went?
And-
Just the 4 of you?
So
Good.
yeah, it was just the team. We went to this Aspire, which is a leadership conference,
Oh,
and
got it.
we kind of
Okay.
did it out of the blue. And so it was Chris Chackney, who's the supervisor for my medical assistants, Brittany DeBurgoso, who does marketing for us, myself, and Taylor.
Okay.
And so
Fun.
on a party bus.
and we rode the party bus up and the party bus back, and we left at 4 a.m. and we got back at like 11 o'clock at night. So it was fun.
That's great.
Good memory.
That's great. It was a long game. Was it after the game you came back or the next day?
Oh, this
No,
is
this was different. This was for the Aspire tour. For the game, Taylor's husband worked out the whole game plan to surprise her for her birthday. So I was like, dude, this is not going to work. She looks at her schedule ahead of time. I'm going to have to try to figure out something to figure
Did
out
it
how
work?
she's not going to know. And it almost worked.
Surprises
It
are
almost
so
worked.
hard.
Yeah, and they both Dan and then you with your on the cuff. I wouldn't say lie. It was more of like a
It was a lie, but
okay. But I noticed, of course, that my schedule was closed for Monday, and I was like, "Hey, why don't I have any patients on my schedule for Monday? Did you close my schedule?" And he said, "Yes, because I'm going to need you in the operating room with me on Monday."
because I was post call. I was post call, and there was a potential I could be in the operating room Monday. So it was maybe like a half-ish truth.
Yeah, which just to me, I mean, I didn't really poke at it. Like I was like, oh, okay, I'm guessing, the licensed surgical assist that sometimes helps whenever he's on call isn't available. So no big deal. I didn't question it. And then unfortunately, my stepdad kind of ruined the surprise because on Friday afternoon, his mom had just passed away. And so I was talking to them on the phone and he was saying he wanted to see my children, his grandchildren. And I said, oh, well, my mom, your wife should be coming up in a couple of weeks to watch them. He says, isn't she coming up there on Sunday?
Oh, no.
And I was like, no, she's not. And he goes, I think she's coming up there on Sunday. And I was just like,
That's all it takes. I remember one time I was having a surprise birthday party for my husband, a really big one, actually. And it wasn't at our house. It was at a friend's house. Everything was great until he went to get a koozie. Well, we have like 100 koozies. So he goes, Linda's, where are all the koozies? And I couldn't think of an answer why there were no koozies.
oh, no.
And I said, because I'm having a surprise party for you, and I brought them over there.
Yep. There you
I
go.
just couldn't think of something fast enough. It was the koozies.
Yeah,
Somebody-
I'm trying to purge all this stuff. We have so much
Every
stuff.
one of them.
Somebody stole our koozies.
It's so stupid.
Crazy.
Koozie thief of the woodlands.
Yeah. Yeah.
Watch out.
Don't ask me. Who knows? Could be anything. Could be anything. Well, Linda, one of the things, I mean, you are a leader in the Woodlands, right? So, I mean, we've already talked about a lot of that leadership stuff, but one of the things I ask everybody, and because we want to try to help build good leadership within our community, within Memorial Hermann, continue to build that leadership, continue to help young leaders become better leaders. What do you think? What do you think is the difference maker between a good leader and a great leader?
So I think one thing when someone's starting to become a leader, they need 2 people in their lives. They need a mentor and they need a sponsor. And you need to know the difference between a mentor and a sponsor. A mentor is somebody that along every day, they're there to help you. This is where you're going to go here. We're going to do this. You should have done this a little bit better. They're kind of on that day-to-day watching you. The sponsor is that person that's sitting at that big table at corporate, that's sitting somewhere else, and they're saying, yes, I think let's just say if my name comes up, yes, I think Linda Nelson is ready for that next position. Or if someone says, I don't think Linda Nelson should even be here, that sponsor is at the head table say, well, let's talk about that because I'm disagreeing. It's who is that person in your business life that is going to be at that table and be your support person right there. You need somebody, and if you don't have one, you need to be thinking, who could that sponsor be? It's really important. Those people that move up and up and up, they've got a sponsor somewhere at that head table pushing them along the way.
Kim,
Both are important, though.
and kindling those relationships, right? That's the challenge, especially I think for physicians, right? Because we tend to lean towards I can do it on my own, right?
Yes.
I'll figure this out. I don't need Linda to help me, or I don't need anybody
Very
else to
much
help me
so.
because I'm a doctor, right? I should be able to figure it out. And so that's really cool because I think fostering those relationships is huge, and you see that within our community, especially at Memorial Hermann in the Woodlands. We see that with new doctors coming in, and then also with the guys and gals, I should say, the physicians who are moving through in that process of chief of staff, chief of staff elect, all of those different things as we keep moving forward.
Like a physician, and I've had 2 or 3 come up and say, how do I get to that leadership role? I'm a physician right now, but I'm watching Jason Piefer. I'm watching Daniel Keevelin. How do I get into that stepping stone to take that place? And there's several doctors that are wanting to do that. And the first thing is exactly what they're doing, reaching out and letting people know this is something I'm really interested in, because there is a pipeline, and it's a long pipeline. You were co-leader for 2 years and then took over for 2 years.
And even secretary, I think 2 years before that.
Yeah, so it's a 6-year move up.
Yep, and even with, I think right now as the former chief of staff, I've got 2 more years still on the medical executive committee, and so continuing. And so the reality when you start to think about that from the leadership side is it becomes even an 8-year commitment once you put your name out for the ballot and get elected to that first secretary position, assuming that you kind of move through the process. So. I love that. I like that mentorship idea. I think is great. Did you have people who were great mentors for you, mentors and/or sponsors?
I did. My sponsor was actually Josh Urban.
I love Josh.
Yeah, he was definitely made some points that kept me going where I was going. I was really impressed with how he helped me along the way. And mentor, it's in different times of your life. My husband had some health problems, so I decided I needed to go back to work. Go back to get my MBA. And I had a mentor along the way when I was trying to decide, do I go or do I not go? And she came in many times. She was across the hall from me. She was a director and said, Linda, you're going to be the breadwinner in your family. You better consider going back for your MBA. And it was her that, if it wasn't for her, I probably would not have gone back for it. And, the one thing I tell my kids, they can never take your degree away from you. There's a lot of things you can get taken away, but your degree you will always have. So,
Taylor, how about you? Mentors and sponsors as you've gone through?
Yeah, definitely on the mentor side of things. I've definitely had those. Sponsors, a little bit more difficult to say because I've always pretty much done private practice, and that structure on a private practice setting is a little bit different.
But you can even put it into some community things that you can be involved in, even moms groups. Is there somebody that's saying, I think that she's really capable and let's keep an eye on her. Doesn't necessarily have to be business.
Yeah, and I'm having a little bit of that now. I'm trying to step up my involvement in some of the community things and make this more of a home. So getting more involved in my kids' schools and things like that. It's always been a challenge to balance that as a full-time working mom on top of taking care of these 3 little people, 2 of whom have some special needs. And so I've always kind of just said, that's not my role. I'll go to work and I'll take care of my kids, but I don't have time for this other stuff. And I've started putting my toe in to make more time and showing my face more at some of the events and volunteering a little bit more. And so, yeah, I definitely have a few of those that have popped up throughout that process. And one of them just gave me a project to take care of, which I was just telling him about, like, by the way, I'm going to be off on these 2 days to take care of this for the school. And he said, request denied.
I always initially, I want Taylor to really, I want her to know that it's not always just going to be positive all the time, so initially we deny every request for any time off, and that's just my standing operating procedure. So, but usually we can figure it out.
Normally,
typically
I say
the contracts, I'm a little bit bound by the contract.
I say I'm not asking permission or requesting off. I'm just giving you a heads up.
Yeah.
What about you? Sponsorship and mentorship.
So, I mean, I think, like you said, I think I've had mentors all throughout, right? Mentors in residency, mentors in fellowship, mentors even as we've moved through here with some of my partners, Brian Comenti, and I mean, one of the big sponsors, though, I would say for me is one of our favorite people, probably your best friend and mine too, Jimmy Field, right? So
yeah.
Jimmy, when
Yeah.
it came to leadership within the Woodlands, and especially in the medical staff. Jimmy was the one who initially reached out to me and said, "Hey, you seem," because I was doing the orthopedic chairman stuff and vice chair and participating with the MEC, and he said, "Do you think you'd ever want to do this?" And I was like, "I don't think I've really thought about it." And then as I thought more about it and how much that I enjoyed working with medical leadership, so Jimmy was really one of those people who I don't know that he ever, stuck his neck out to say, "Hey, this guy's not as big a ding dong as you might think he is." He may have. That's very possible. Very,
So
very
that's
possible.
exactly what a sponsor is. Just
Right.
exactly what you're saying. He was already in a leadership role, and I can guarantee you there was conversations about you in the higher up leadership.
Oh no, there's no
Yeah.
question.
And
No
that
question
was
in my mind.
him,
Yeah.
right, bringing your name forward and saying this, giving a lot of support.
And I love Jimmy to death. He's awesome. He's a great, great friend. We love drinking wine together, but also love serving at Memorial Hermann the Woodlands Medical Center. And he's been chief of staff, former chief of staff, and he still continues to participate with the medical staff. He still comes to almost every wine dinner planning with you because he has such a vast knowledge of wine. And so we'll get Jimmy on here one of these days.
He would be great.
He would. I think he would, but I've asked him a couple of times and he's given me the bit of the side eye for it. So we'll see.
I think, sometimes you have to push him.
Yeah.
He likes to give side eye.
We have like about 30 subscribers, so it's pretty much. I mean, it's almost Joe Rogan, but I mean, it's gonna be fine. We're gonna be good. What else? If you weren't doing what you're doing now, right? And you are in politics, I guess, to some extent. But if you weren't doing what you're doing now with Memorial Hermann, what would you be doing?
So if I had a choice, I'd be working at the Economic Development Partnership, EDP. I'd be working with businesses and just the collaboration, the relationships, and seeing how we can support them and make them bigger and better and bring them into the Woodlands area as well.
Yeah.
For sure. And then I love politics. So I would definitely, if sometime in my life, I probably would like to have been in Congress or something along those lines.
Well, you invited me to the Economic Outlook Conference 2 years ago. It was the first time that I had attended, and I was like, man, this is crazy. And they're talking about AI. We talked about, that was the first time really in my career that I'd heard medical scientists talk about curing cancer, not like it was like some sort of dream. Right? I mean, because that meeting, they were talking about the developments and how AI was moving us in a direction to basically, almost every person to a T said within the next decade, maybe 2 decades at most, we'll have a cure for most cancers just because of that power of AI and the power of research that we have the potential to develop.
AI is life-changing.
Yep.
They helped me write a speech today.
Nice.
I think they're amazing. And then people have to pay attention because when people are going to school, they need to be thinking, wait a minute, is my job going to be there in 4 yeast, 5 years, 6 years?
Right.
Or is AI going to pretty much take it over and there'll just be one person over a lot of this, keeping an eye on it? It's breast radiology. Today is the beginning of Breast Cancer Awareness Month. It's October 1. Thus
Pink
also
sash.
the pink sash.
And all the pink behind there that was birthday
yeah.
/ Breast Cancer Awareness Month. Yes.
So tonight we're actually dedicating the breast center it's going to be called the Melissa Preston Breast Center, and that'll be tonight. We have about 100 special invites coming in from Melissa's family. She was actually a very good friend of mine, struggled with cancer, died from that, and her family gave a sizable amount of money to renovate the breast center, and therefore we named it after her. And we're really excited to have her name forever on this building.
That is amazing.
Yeah.
Amazing.
Yeah.
Well, what else? What else can we talk about? Oh, doctors. We're going to talk about physicians and specifically either challenges or things that you love about working with docs.
So my favorite thing is being in the physician's lounge and just watching the newer ones come in and kind of tentative. Where do I sit? Who do I even talk to? And then they go way in the corner so you can't even grab them to come and sit at the table because they're in the corner. And I get that. When you walk in somewhere new, you don't know anybody. You think everybody knows everybody. But I want them to sit at those big round tables so that they can get to know everybody. I think we have an incredible medical staff. I think we have around 1,600 physicians on our medical staff. And they all just seem to collaborate well with each other. I think the one thing I always tell my kids, and if I'm ever with a physician too, is you have to be liked before you can make a lot of changes with anything. So don't be such a hard person. Let people into your world a little bit. You were saying, I think I can do things by myself. People like to be asked to help or ask their opinion on something. And I see that when I'm in the physician's lounge and you see new doctors talking to each other, and all of a sudden they're getting engaged with each other. Then they're exchanging contact information with each other. And then they're referring to each other. So it's just watching those relationships build right in front of your eyes. And I think that's really important at Memorial Hermann. It's a close-knit group of physicians, for sure.
I agree. I mean, I think it's an amazing environment, specifically just because of that, in that realm. And Taylor can tell you the number of times that I get a text message, hey, could you see this person? Or, hey, just want to let you know that patient you sent over this way. But when you have a personal text, you're not having to deal with answering machines. You're not having to deal with phone logs and all this other craziness. And so it really, it's better for the patients. I think it makes the relationships a lot better here too. And then it just makes, I don't know. I haven't been to a lot of other places, so I don't know how the physician lounges work in other places. Not like the Centurion Lounge at the airport where you're trying to sit by yourself and be quiet. We are collaborating all the time, and half the time, on my list of people that I need to talk to, whether it's the trauma service or neurosurgery or the hospitalist service, I'll run into somebody from that while I'm in there, and I'll check off my
and look
checklist.
At the amount of time that has saved you.
Absolutely,
Yeah,
100%.
Yeah. And I do think that's something I've seen that's unique to Memorial Hermann, the Woodlands specifically. I've worked with other places, and I think that the collaboration that just happens there, in the lounge, but just also, like you said, with the text messages and such, the patients are the ones who really benefit from that. Not, the fact that we see somebody in the clinic and go, oh man, we need to get them in with infectious disease pronto. And we, have our resources that we can just send them a text and say, hey, can we take care of this person who's got this going on? Absolutely. I'll get them in today.
Yep.
Or we run into him in the lounge when we're going to eat my salad, him to eat his gluten-free brownie, which has no calories apparently.
No.
Zero
I think
calorie.
you're eating those chocolate chip, oatmeal, peanut butter, whatever else is in that.
Also possible. But that makes a big difference even in a patient room. The number of times, I probably at least once or twice a week will call a consultant, whether it's neurosurgery, spine, somebody, and say, hey, I've got one of your patients here, or hey, can I get this person in? Or hey, we're about to move forward with, we're going to do a total hip on this person. Can you get them in so that we can get them optimized medically before that total hip happens? And that makes a huge difference.
It's huge. When a
timing,
patient, everything.
When you call a physician and the phisian answers and the patient is there sitting in the room while you talk to them, they're like, what's happening?
Yes, I totally agree with that.
And that's really cool and super fun to be able to do that, and that's what this community builds, and that's what the community inside of Memorial Hermann builds. But that's top-down leadership, both physician-wise and administration-wise,
totally
but then all the way through nursing, all the way through, and the entire staff at the hospital. That's just
it's
the environment.
Culture.
It's the culture,
and making sure they hire the right people.
Right, and we have high retention. We got super high retention.
We've got the lowest turnover rate of anybody in the system.
Awesome.
Cool.
And why would they leave? Look at the building. Look where they work.
We got helicopters hovering over the top of parades.
Float.
Yes, it's beautiful. It's
but
beautiful
there is
stuff.
something about seeing a life flight. I was walking my dog the other night, and there goes life flight right over me. The lights are on, and you're just so proud. You're thinking, okay, they're coming back from right now, because I could tell they're heading back to hospital from saving somebody, or they see the worst of the worst.
Right.
If life flight's called, it's not a good scene.
Right, and they're the first, or maybe not the first on the scene, but they're the people who are getting folks delivered to us, and so that relationship is amazing.
Right.
To get to have that.
Right, and I also want to talk about the relationship with the Montgomery County Hospital District. That EMS is amazing, just absolutely amazing, and they're coming up with new models and new procedures and policies all the time. Justin and I just spent a few hours with James Campbell, who's the head of all the ambulances, the chief of EMS. And they're just an amazing group. He's got 500 of them reporting up to him, and they're very important to the hospitals when they bring them in.
Well, on the trauma committee, I sit on the trauma committee, and they sit and they've got a report for us almost every month. I think every month they have something. And so seeing where patients, what our volumes are and where patients are going and what things are happening. And then when they have new protocol changes that are instituted by their medical directors, those things are coming through to us, and they take input from our trauma committee and take that back to their trauma medical director as well. So that's pretty cool.
I asked Chief Campbell to come to our township board meeting a couple of weeks ago because of all the pathways with all these electric vehicles now. People that are walking on the paths are saying the electric vehicle shouldn't be on there, and that's everything from the scooter to the electric bikes and now to those small little motorbikes. And so they're now classifying them as high velocity vehicles. When there's an accident involving any electric, that's how it's coming in. So his analytics are pretty impressive as far as keeping track of how many accidents are happening because of that. And the problem is these kids are young. They don't know that they need to stop at an intersection, and they don't know if you're coming down this way, someone's turning this way, but they're really looking the other way.
Right.
There's a lot of parental guidance and education that needs to be done.
Yeah, we definitely see them. We definitely see them in parking lots of the grocery stores and other places, and they're just going crazy. But yeah, I see them all the time taking call because patients get injured and they have fractures, they have major issues because they're going 20 plus miles per hour, many times without any helmet. Most kids who ride a scooter
80% of the time, no helmet.
Right, no helmet, which, we sort of transitioned in a lot of sports, right? Skiing, when I grew up, nobody wore helmets, and if you wore a helmet, it wasn't cool. Now nobody skis without a helmet.
Right, and they're all not skateboarding. What are they?
Snowboarding.
Snowboarding.
Yep.
Yeah.
Cycling.
And they all have,
Cycling, when I grew up, almost nobody wore helmets. Now we're moving in that direction.
But it is hard when you see a 12-year-old on one of those scooters going really fast with someone behind them on, holding their waist.
Holding on.
Neither one has helmets on, and you're thinking, all you have to do is hit a branch, and you're going down.
Yeah. Well, we sometimes have people on non-motorized knee scooters if they have a fracture of their ankle or something like that. And almost all my patients who have one of those knee scooters that's foot powered with their other good foot will have at least one fall off of that scooter because the wheelbase is so small and they hit a crack in the pavement, or they hit something funny on the floor at work or whatever. And so
I had 3 wipeouts on mine after I was on one for 6 weeks.
3.
I had 3 wipeouts.
You didn't learn after the first one.
No, the brakes were a little bit tricky on it, and I was in clinic, and I was trying to see patients with my laptop balanced on the front.
I think I actually saw you with that one time. Yes,
see what you got to do.
We had a scooter. My wife injured her ankle skiing, and we had a scooter, and somebody came to borrow it, and I was like, just remember, if you try to do this too fast, you could fall. And I took it out the front on the scooter, and I almost wiped out, leaving out of my front of my house. And I hit the brake in the sidewalk and just almost went over.
That's what I mean.
It was crazy.
It's really easy. That's why you need that helmet
easy,
on. Very
easy. Well, Linda, it has been a pleasure. It's always a pleasure to be with you. Favorite pie is key lime pie.
It's sitting right in front of me.
It is.
I'm so excited. That's really nice.
She asked for some water, and so we got her a key lime pie. You know that I love you. You are awesome. I really appreciate you coming and taking the time to be here. I am even more appreciative of all the things you do. All the things you do for me, for Memorial Hermann, for the medical staff, for the township. It's hard to thank you enough. But we'll just keep hanging out, partying, and we'll have fun.
Let's do that. Thanks for inviting me. Appreciate it.
Thank you. Oh, but I forgot to do this. And then you have to.
Oh, now we dance?
Now there's dancing.
What's next?
Thank you, Linda.